Hello, I'm Kevin Mabbott, Chief Consumer Officer of Intermountain Healthcare. I'm here today with Dr. Marc Harrison, our President and CEO. Marc, so welcome back.
Thank you.
So 29 was a really successful year for Intermountain. As we go into 2020, what are the goals you'd like us to be accomplishing?
2019 was a great year, and I think we made enormous progress on many fronts. I think that we as an organization have exactly the right strategy at this point in time. So we are working on traditional Intermountain activities, safety and quality, patient experience, caregiver experience. We're working on the value equation, so we're working hard to make sure that we can provide the care that we do and the prevention that we do at low cost. We have an appropriate growth trajectory in place, and I am so pleased with the work that is being done in Nevada at this point in time. We're really off to a great start at serving that community. So to a large extent, I see ongoing refinement of the work that we're doing, but not huge right turns or left turns for the organization. We know that we went through a lot of change a couple of years ago, and we're still figuring out how to work in our new operating model, but I'm seeing very positive signs all around us that this is going well, by and large, and that we'll keep working together to refine that.
So affordability,
Yes.
Really big challenge, but we're at it. Could you talk a bit about that as to the importance and how you focus on that?
Yeah, Kevin, and this is a complicated one, right? About a third of Americans are rationing a prescription drug. About a quarter of Americans are foregoing health care at some point during a year because they can't afford it. We know that the most common cause of bankruptcy in the United States are health care associated costs. And we know that when we talk to people in the community and survey them, about 3/4 of them still believe that the health care that we provide is way too expensive. Now, the irony there is that we know that we're amongst the best in the country, that our charity care policies mean that no one should ever go bankrupt for our care, that we work really hard with people on that. We know that when we look at the percentage of people who have unaffordable care in our system, it's about a sixth of what the rest of the country is experiencing. So we're really good, but we're not good enough. And so we need to keep chiseling away at this. And that will require the things that Intermountain's so good at: innovation, service, commitment to mission, openness to new ideas, and then a really ability to implement and execute like nobody else. So that's what I'm thinking.
Yeah, so as we focus on being as affordable as we can for our patients, our members, on our side, that means some tough decisions often, and we think as we do that work, always about the impact on caregivers. Could you talk about that dynamic?
Yeah, I want to lead by saying I believe that the people who work at Intermountain in all capacities, our caregivers, are without a doubt our greatest asset. And we want them to have great experiences at work. And we know that healthcare is a stressful environment to work in. We know that sometimes things like electronic medical records can add angst to people's lives. Changing operating expectations can make people feel unbalanced. So I don't want to diminish or ignore any of those things, and certainly not sweep them under the rug. But together, we're going to still need to work on doing things more effectively. And we had a misstep just before Christmas. I think very thoughtful work was done to look at some of our benefits, including specifically how big our PTO bank was. We were shocked to understand that there's some operational challenges associated with ratcheting that PTO bank back to, by the way, what is still about 3 times the industry average in terms of number of hours that people can bank. But we actually found out that there were a lot of our caregivers, particularly frontline clinicians, who were using that PTO bank to keep themselves whole when they were called off from a scheduling standpoint. Now, one could argue, and they'd be right, that we should have known that, and we did not. And so we need to have a better sort of early warning system for if we're going to make a change. We certainly don't want to cause people anxiety or heartburn in any way. But the fact of the matter is I've uncovered some things that are really not okay. So lots of really good people who've been able to work very much part-time and get full-time benefits. Well, a person next to them is working full-time for full-time benefits. There's an inequity there, and it's not okay. So what we need to do as leaders, and this is really a local leadership issue, is the scheduling needs to occur in a way that people aren't called off. They get the hours that they were hired for, and they can earn those benefits that are very important to them. And so we will work with those leaders to make that so.